End-of-life care, taking care of people who are terminally ill or people who have severe illness, is an area of a lot of controversy these days. One of the problems is that there's a lot of money and a lot of time and a lot of care that's spent on patients in the last year or two of their life at a time when it's not clear that all of this aggressive treatment is actually doing any good. So fortunately, I'm here today with Dr. Nathan Goldstein, who is an associate professor of clinical medicine at Mount Sinai Medical Center and also specializes in palliative care and in geriatrics. So welcome and thank you for coming to talk to me.
Thank you very much for having me.
What are some of the big issues here?
Yeah, I think one of the biggest issues is the fact that doctors may not always be the best communicators, right? And so one of the things that we do is we know more than we may talk to the patient about. So the classic example that I always think about is we'll ask to patients sometimes, patients with serious illness, you know, if you got so sick your heart were to stop, would you want us to restart it? And the patient's answer is always, yeah, my heart's pretty important. Of course I want you to restart it. But what we may know, for example, in a patient with advanced cancer is that it's very unlikely that we can restart the patient's heart. And if we are able to, the chance that they would come back to be the person that they are, the person that can interact with their family in a meaningful way is very, very, very small. We're often called in palliative care because the patients don't understand or the patients don't have a realistic viewpoint or goals. And actually, it turns out that they have completely realistic goals once you explain to them kind of what the real potential outcomes are, right? So instead of saying, you know, well, we don't ask, do you want more chemotherapy? We ask, what is it the goal that you're trying to get to, right? And the answer is, I want to live to see my son graduate. And we say, well, you know, maybe we can think about a different way to make sure you're comfortable and you have the best quality of life to get to that point. And so it's about trying to communicate better with patients and families. And I think much of what we do in palliative care is actually educating other clinicians, physicians, nurse practitioners, physician assistants, to ask the right questions.
I would think that you would really work beautifully with the doctor who's been the family doctor for a long period of time, because I think one of the issues now, at least that I see, is care is so fragmented. Somebody comes into the hospital, they may be ill, they're seeing doctors for the very first time. Their doctor of long standing may be outside the hospital, not even have admitting privileges. Maybe
Right.
It's not because of the hospitalist system able to really see them every single day and be writing orders. So you have that fragmentation of care,
Right.
and maybe it's the doctor who really has that long-standing relationship not only with the patient but with the family,
Absolutely.
and who really can start
Absolutely.
to facilitate, to help facilitate better communication.
I think, you know, one of the things that we do in palliative care is really try and get all the docs on the same page, right? So when I go in and see a patient and a family, before I do that, I've spoken to their primary care doctor and every other doctor taking care of them. So I can begin the conversation with the patient and the family, because remember, I may often be a stranger to them, and say, you know, I've spoken to all of your docs, I have a sense of what's going on. But then the next thing I do is, but tell me what you understand and tell me what the doctors have told you. So we can figure out not just what they've been told, but really what they understand.
So I think with this discussion, we've given people a sense of some of the issues and maybe the importance of communication. Let's leave people with some action items. How do they start the conversation if the doctor doesn't start it? What are the kind of things that a patient can do?
So I think one of the things that a patient can do is say to their doctor, this is what I'm worried about. This is what I'm concerned about. This is what I'm most hopeful for, right? And the second thing they can do is when a doctor says, what about this treatment, or I want to offer this treatment, we often think a lot about, well, what are the side effects, and you know, is it gonna make me sick? But it's also, and what are the realistic outcomes of this treatment? Is it gonna make me live longer? Is it gonna make me feel better? And is it gonna improve my quality of life? And we're always focused on the first one, but it's the other two I think are often just as important.
That's a terrific conversation, terrific advice. Thank you so much, Dr. Nathan Goldstein.
Great, thank you so much for having me.